details of the program. Many of you know that it is a book launch of one of my publications, which is for people in general, not only, nothing to do with people suffering from mental disorders. It's for me and it's for everybody. But I have taken this opportunity to pad this program with something very interesting, and that is the stigma. And my thoughts were that since stigma has something to do with the family, with people in general, not much to the hospitals and patients, I must ask this question going amongst people right in the middle of this city. What does it mean to them? And I'm happy that you are here to participate in this interaction, in collaborative discussion. And I'm joined in this initiative by my distinguished friends and authorities in mental health, science, research, clinical practice, education, and academia. I welcome Dr. David Hill, who is Chief of Lawson Health Research Institute, and needs no introduction. Dr. Robbie Campbell, who is Professor Emeritus at the Western University Department of Psychiatry. I've worked with him for a long time. And thank you, Jeff, for being here. Now, to begin this, I would invite Robbie. Please join us for Thank you very much. I'm in the city for last about 14 years. Immigrated from England and relocated from India. And I take this opportunity to thank you, Canada, for giving me the shelter, bread, butter opportunities, immensely friendship, collaborations, academia, and whatnot. It has been a happy time, and I recently changed my profession, quote unquote, retired, and a couple of my esteemed friends said that I need to do things more outside than inside. And this is the first major work that I had undertaken, and this is the time that we talk about it. Now, I will take this opportunity to invite Robbie Campbell, who will lead the discussion on stigma. The program of next 3 hours is very simple. For next 1 hour, we'll talk about stigma. I would be delighted to hear what people, what my friends, relatives, people in the families think. Is there a stigma about mental illness? Is there a stigma only about mental illness? Is there no stigma, it's all in the books? Do people accept mentally ill person? Should there be voting right for mentally ill people? What do you do if you come to know the Chief of Army Staff has had episodes of depression? These are the issues which bother us. They decide the fate of humanity and countries and war and democracies and so on and so forth. They're not very simple. They're not just illness. We're not referring. We are not talking about dysfunction, disorder, biology, any compartmentalization of it. We're talking about the implications of human behavior in a larger perspective. And there comes the question, do people discriminate? Is there prejudice? Are human values really going to be guided by these figures? Do we diagnose people far earlier than they really become ill? Do we treat more? Are our treatments stigmatized? Do doctors discriminate? Are we responsible for not doing enough for eradicating stigma or indirectly contributing to persistence of stigma? What do people feel? I have my family members in this audience. I have my friends whom I know for the last 50 years. I have people who have just met friends. So it's a spectrum of relationship that this hall represents. I don't think there can be a better forum to discuss these critical issues from people's perspective than this hall. Without delay, Robin, is over to you.
Thanks, Amrish. I first want to begin by thanking you for inviting me to speak a little bit about this topic, and especially to be here for Mind Matters. I must start by saying I've had the opportunity to read the book. I must say I was very impressed with how Dr. Srivastava outlines the importance of the past, the present, and the future, and how he combines them in each of his stories. His stories are the essence of the book. It's well worth looking at because each story tells its own story. But Dr. Srivastava wanted me to start off and discussing a little bit about the stigma, just to open it up a little bit. Maybe spend some time reviewing where it stands. So if you look in the dictionary, so, well, what is stigma? Well, there are different kinds of directions that they tell us. Something that detracts us from the character or reputation of a person or group. Something that leaves a mask of disgrace. Something that leaves a sign that something is not considered normal or standard. How do we incorporate what some people see as abnormal into normalcy? That's part of the question. I'm thinking mind does matter. I mean, we can have Black Lives Matter. We can review the Holocaust. We can review the whole Pride movement. And looking at this, these are groups that on the surface some people condemn and criticize. Why? I'm not exactly sure why, but I know it's entrenched somewhere, and we learn some of this kind of behavior. The other part of a former sort of definition of stigma has to deal with, it's a distinguishing mark or cut into the flesh, as if you have been a slave or a criminal. I'm reminded here of Sheryl Crow's famous words. The first cut is the deepest, obviously referring to relationships and what happens in certain relationships and where does the prejudice bias come and how does it interfere to the point that it moves forward into a direction we don't want it to take. Cutting, I'm reminded of some of the patients that we see who have a history of self-harm behaviors and cutting behaviors, and sometimes even people within the medical profession ostracize or keep them at a distance or are frightened to deal with this kind of behavior because they don't know where it comes from. It includes suicidal behavior, depression, and a host of other mental illnesses. So what's at the root of this unfair ostracism, if you wish? I guess part of it has to do a little bit with a lack of understanding. That's why I like Dr. Shrivastava's book so much. Is because when he outlines a story, it might start here and go back to what is the root of causing this, and it also takes you forward what's happened down the road after we address this problem. The other part of it is do we get, and Dr. Shrivastava just alluded to it a few minutes ago, are we as professionals, are we as family members so entrenched in our own self-thinking, our own opinions, that we forget to listen? My biggest criticism of the medical school and the teaching of medical students, for instance, is that we're not teaching people to listen. We're busy recording stuff and collecting data, and we're great at that. And doctors, you can visit the doctor and they're looking at the data machine and plugging it in when you go, what happened? And oftentimes people come out and say, the doctor never listened. All he's doing is reading reports and doing things. Listening. So this brings us to what's been happening out there in society. Bell, let's talk. I think that's a great thing. It helps to destigmatize mental health, and it brings people to the forefront like Clara Hughes. She helps us to realize that mental health is not only normal, but it's vital. Dr. Shrivastava points out in his book that we all need someone to talk to. And that's very, very true. He tells us in the book that it's the simplest and most effective treatment that we have. I believe that. And I believe we're forgetting that in most of the people we professionals see, whether it's psychiatry, psychology, dietitians, nurses, psychologists, the whole gamut. He points out, too, that the time is to start now, because the longer we let things go, the longer we don't confront the stigma, the longer we leave it go and sit back, the harder it is to make an inroad into the thoughts, feelings, and actions that rapidly escalate, and what presents itself, someone gets very seriously ill. The experience of inadequacy and loss of confidence, in Dr. Shrivastava's words, is unbelievable. I like his phrasing in the book, and I guess I'm trying to encourage you to make sure that you do get a copy, because it's worth reading. And it's worth reading no matter where you are on the spectrum, whether you're a person that suffers with a mental illness, whether you're a family member, whether you're a student, whether you're studying whatever discipline you're studying. It's an important read because it puts it all in simple language. He says to talk, we need to be the listener, but we have to listen. We have to have someone hear our story. We have to hear someone hear our unique perspective of our story. And we have to have someone recognize and acknowledge our unique identity. Because we start moving into identities, we start moving into cultures, we start moving into a host of things. The book shows us the value of listening and hearing the lifelong novel that each one of us has locked inside. He points out that many of us are reluctant to disclose our stories. And if we don't disclose them, why don't we disclose them? Because we feel we may be frowned upon, we may be discriminated against, we may be rejected. And that in fact may lead to self-stigmatization. I like his words when he opens up with, he talks about learned helplessness and what's the relationship of that to self-stigmatization, because all of a sudden you start believing what people are out there and you adopt what people are saying as reality and you take it out on yourself. This isn't fair to those that suffer, and it isn't fair to us in the professional world of not taking on the responsibility of teaching others to acknowledge this. He reminds us that we have to pay attention to those around us. That includes our friends, family, and colleagues, because oftentimes they hold back, not wanting to share their experiences with us. And they need our help more often than we think. We have to allow them to talk, encourage them to talk, and give them permission to talk. And don't let stigma stand in your way of doing this. Mind does matter.
I think, Robbie, thanks. I think as we had announced that we'll begin by having a good conversation about stigma, and then have a formal ribbon-cut release of the book as speed. Then we can talk about the books. But anyway, if it is intermingled, Matt, I take 2 minutes to tell you what stigma, how the reports appear, and divert yourself from real life agenda. The patient becomes absolutely unimportant, and that's one way to cover up the deficiencies at all political levels. And as I said in the opening remark, that mental health is one factor which touches all areas of individual's life, everywhere, whatever you think. I think part of the problem is that we are paying price of some historical mistakes, and the historical mistake was dichotomy of mental and physical and chemical and biological. Health is health, nothing more, nothing less. And if this dichotomy that mental health is a far worse concept than physical health would not have been there, but it is there, and we have still failed to really integrate it as well as it is required. Prakash.
Thank you. I think to prevent abuse of psychiatric patients by the system, the fight that advocacy and
Developed countries it is a region specific. In fact, Canada is champion of stigma research. The first World Health Organization initiative, along with World Psychiatric Association, started at Kingston, and it has been right in the forefront. There is so much contribution, and I think it's matter to celebrate that stigma research in Canada has been is continuing. It has the leadership role in that. I read in the newspaper 30-second story I would share. A psychiatrist was giving an interview to a press, I think it appeared in Washington Post. They were talking about a book. And she quoted that, I had a patient who had depression for the last 30 years. And in 30 years, he never spoke about his specific symptom. And suddenly he turned up in the office of his psychiatrist with a book and a corner page molded, and opened the book and said, you're not asking me the question, and this is what I'm suffering from. Another report I read that a young 35-year-old female was locked in the house for 17 years. And this appeared, I think, in 23rd of September 2009. I included this. The relatives has locked the patient, and this is in a mega city, millions of population, For about 17 years, they were giving food, water, everything from below the door. Never she came out, no treatment, until non-governmental organization somehow traced, reached, intervened, and the police case was filed, etc. So just open, I would like you to now raise questions. I have my colleagues to answer. What do you think? Is there a stigma in families? Is there stigma in the family? Yes, please.
Yes, there is. There definitely is. And it doesn't matter whether it's in Canada, whether it's in England, whether it's in India, there is a stigma. People have no problems in accepting help when it's a physical condition. But there's something about any kind of mental health issue, anxiety, depression, bipolar disorder, you name it. Everybody stays silent, and it's all hidden in secrecy. And like you said, it's because of the attitude of families, society, practically everybody. And yet you mention any other physical illness, immediately everybody comes around, they're out there to support you. If you said, I have depression, first of all, you have to speak up, right? And secondly, who's going to come and listen to you? So there definitely is stigma everywhere, and I think
Thank
we
you.
have to be
I think
advocates for it.
I want to listen from, is there more in families or it is more outside the families? What do you think? Is the stigma for mental illness more in families?
The stigma both inside and outside the families, both, I think is both true, and it exists here right in Canada. I have experience in my distant family. It's the same story, nothing different, same story. So both inside the family and outside the family. As Dr. Venkatesan mentioned, that when the question of mental illness comes, everybody keeps silent, this month.
Why is that? What do you think? I want to capture, you see, the purpose is we are in partnership with LUST. We're trying to find out the real question to give it a research focus in future. Why is it that people don't talk about stigma? And that is why I'm talking to people, the doctors, families, friends, students, elderly, anybody and everybody. What do you think? Why do they not talk about this, please?
I think it's because mental health or mental illness is on a spectrum. We all experience some degree of anxiety, depression at times, and so we feel vulnerable. We think that this could happen to us, and maybe we are afraid to go there because we know that this applies to us as well to a certain degree, and it can be a personal thing because nobody is free from all the symptoms of mental illness. We all have it on a certain spectrum. So it hits pretty close to home when people start talking about it.
Yes, I agree. And I think hi Simon, I'll come to you. Give me 1 minute. What do you think? Is there stigma? Is it more in family?
Stigma is definitely there, and I just feel that we as human beings find it very hard to accept another human being who's a bit different. That has been there from time immemorial. Personally, I feel that as human beings, if we can be confident of who we are, not what has actually happened to us, then we can make a difference. And I'm talking this more from the patient's perspective. But that's the reality, is that we find it hard to accept another human being who's different.
Thank you. Simon, has the stigma reduced over time? Do you think there is a change?
But I would like to comment, I think the major origin of stigma is that there's so much mystery that we don't know a whole lot about mental illness until the dawn of the science. And I think that's why that when we don't know, that we are afraid, and we tend to associate people with being possessed and so forth. But I do feel that the salvation of this stigma lies in the advances of our medical science that can liberate us from thinking mental illness rather than as a disease of the mind, but rather as a brain disorder.
Very controversial. I'll come back to you. God, please. Yes, please.
I think we have to distinguish between interactions between individuals where stigma could be seen as a negative force, one-on-one, and systemic discrimination. So many of us call ourselves psychiatric survivors. In other words, we survived the psychiatric system, and what we experience is saneism, which is discrimination based on the idea that there's such a thing as sanity. Because people who live in different cultures, in different places, will know that what is considered sane in one place could be considered insane somewhere else. So that standards of behavior are relative. But high rates of unemployment, difficulty getting affordable housing, people struggling to get physical health care needs met when they have a psychiatric disability, those things are across the board. So I think it's important to distinguish between stigma, which is one-on-one, and systemic discrimination, which is like saneism, is like racism and sexism and heterosexism.
Wonderful. Thank you. Good thought. I think I say hello to Paul and back to you, my good friend. So, do you think stigma exists in relationships? Do people hide each other with each other, living together, hiding the problems of mental illness? Do you think so?
Yes.
Yes.
But I think it's comes from two fronts. One is denial. They live with someone, they've seen it, and perhaps when it's revealed clinically in the future or down the road, I knew that. I saw that, and I just didn't react. I didn't do anything. So that, I think, is probably very common. Denial can be both, they don't want to believe, and therefore their relationship and perception of the relationship doesn't have the qualities that they hope or they perceive, plus the reality.
So I'll just take 30 seconds. The story of a 28-year-old boy who was not well, started hearing. Now he comes out of the jail and talks to his friend that I was hearing voices. And the voices were so compelling that I was thinking nothing but whatever I was told. And what I was told that my girlfriend is standing behind with a seeker and she's going to kill me. And he said, I went around from room to room to room to room for nobody. But I saw that she was doing something with the flower in there. I went there, caught her with the neck, pressed it as hard as it needed to kill her. But today, the voices are not there. She is not there. I don't know whether it was ignorance or my illness, lack of education or insight. So this regret after an incident, when people start questioning that how come I did not understand implications of something happening in my life? What was it? You think such florid situations contribute to stigma?
Well, they certainly do.
What I hear, it's pretty clear that the stigma is universal. It's there. But I will, before raising another question, what can be done? I'll give you one example about, say, let's go 100 years back. And a disease called leprosy, Hansen's disease. Every family, everywhere where somebody used to be affected, no questions asked, nobody used to see face, nothing. And the governments had found the best answer to put them in a sanatorium, outside, away from your country. The famous sanatoriums for leprosy. But the same governments today, they've done away with it. Nobody thinks about leprosy in terms of stigma. Everybody goes, takes treatment, comes back, they live amongst us and no questions. We don't find sanatoriums for tuberculosis, do we? We don't find sanatoriums for leprosy. But these are the two conditions which are historically most stigmatized. When you think, why is it that things have changed? The one thing which is responsible is availability of care. This is the story when we did not have any treatment for leprosy. We did not have any treatment for tuberculosis and things were bad, and as a society we had accepted this is the end. Nothing. Keep these people away from humanity, civilization, all kind of systems, because we are helpless. But things changed. Things changed because treatments became available. Now, the second piece is availability of treatment in books is not enough. It is the care which has to be available. Available to all. Available when I want it. When I want it the most. And in the cost that I can afford. And if you don't give me the treatment, the cost that I can afford, then not me, you suffer as a nation. You'll have to make another sanatorium. So the change will come with science. It is there. But I don't know. Do you believe that things will change if more treatments are available?
I still want to talk about is there stigma.
Please.
I have personal no experience about it, either in the family or in the society, but I can theorize it. In my opinion, our society is so individualistic. They have no time for other people. The stigma is in the family and the friendly circle.
Thank you. To add on to it, if you really review, our colleagues will name, there is high stigma in the medical professions. Not only medical, in mental health systems. The first barrier we have to cross as mental health professionals to win our own attitude and our stigma prevailing. Yeah. Personality disorder. I waited 6 years to talk about my mental health. Bipolar is my best friend and worst enemy. My depression was made worse by secrecy. Nobody tried to understand my bipolar disorder. So, as you see, the common theme is a need to know more. A need that I wish somebody could understand. I wish there was somebody who could know my problem without me speaking, telling anything. There is so much desire amongst people to share. And possibly people not getting that opportunity is complicated. Opportunity at a right time to really share, maybe increasing their distress, their problems, or making them more frustrated with the system, making them more frustrated and hopeless in the sense that can my problem be sorted out. So I thought it is good. These are the thoughts in last 3 months. Some people have, highlighted the way. I remember one of the research in which the team analyzed survivors of suicide attempt, and they said, "Tell me one thing which could have been done by you." And the finding was that overwhelming majority of patients said that my family would have saved me only if they would have talked. Now, we are coming back all the time to family. Now, when the family structures have become loose, so we ask, what is the family? What is the definition of family? Parents are out in, say, Yugoslavia, and somebody is here, and their children are in Texas. Where is the family? I would say we need to really redefine this term, the family. It is not a physical commodity. It's not in the physical sense of the boundary. The people you live, you die, you breathe, you eat, you work are your families. And you need to redefine this. If you go by historical concept of family, it's gone. It's not there. And you are in illusion. You are trying to capture something which is not there. The gentleman is born in Japan, is educated in India, he did his first project in Nigeria, and he's got as a first employment in Western, and got a promotion, went to US. So where is the family? Can I reverse the change of the cycle? And then why are we asking, why are we passing the blame on family, family, family? This is my family. And we need to reconstitute this theme. There is a very strong need for a radical change in the thought process. The God is where you are. It's wherever Lord Rama lived, that was Ayodhya. It's coming from a religious teachings. What does it mean that about 3 to 4% of population of the world is always in mid-air? They're flying. We know that people who immigrate have a very high degree of psychiatric morbidity. They are at a high risk. So we have countries within country, cultures within culture, families within families, dysfunctions within functions, and we are refusing to recognize these variations. This is one part of the problem. Times have changed, our textbooks have not. We are not able to, the other day I was talking to some other group and they said, what should be done? I said, don't go to a psychiatrist to find out the answer, because we are trained to respond in a very, very typical scientific way. And that is why when I said I'm going to have this workshop, I wanted to hear from you what you think is the answer for your problem which others are not doing. So I think it's 4:30. I think I will change the tune and request to David to come on the dais and Robbie to do me a favor of releasing the book, and then we talk about the book, whatever my guests think of it. Please. Yes, so it's session 2, and after that we will be chatting about the book, and like our colleagues to really raise questions, talk, whatever is. I may give some of my observations as directed by David if he wants, and after that at the end the book will be available to those. I hope each one of you can take, and I'll be signing the book. Over to David, please.
Thanks, Amrish. So it's a great pleasure on behalf of Amrish to formally sort of launch this book, Mind Matters, a Psychiatrist's Narrations. And everybody in this room, I think, knows Amrish well, but this is an academic milestone, and I think Amrish deserves to have a small narration of his academic achievements before we start. So, Amrish Shrivastava is a professor emeritus now at Western, but he's still an active scientist at the Lawson Health Research Institute. He has a very distinguished career, qualifications from India, from the Royal College of Psychiatrists of the UK, the Royal College of Physicians and Surgeons of Canada, and also as a fellow of the American Psychiatric Association. He's a man, I think you will agree, at the top of his trade. He's been an editor and has been on the editorial board of some of the most prestigious journals in psychiatry worldwide. It's really difficult to pick out a specific contribution, but one thing that really struck me was the 5-volume book entitled Suicide from a Global Perspective. And I think you really are one of the thought leaders in that, and certainly in terms of knowledge dissemination, being able to disseminate current thinking in pieces of work of that quality is a great achievement. I think Amrish understates probably his contributions to advocacy. I've seen this very clearly in the time that we've been together in London, and the work of Amrish and others really raised awareness around the needs for mental health, and that resulted in 2006 in a really seminal document. The Michael Kirby's document, the Standing Senate Committee on Social Affairs, Science and Technology, with a report called Out of the Shadows at Last, Transforming Mental Health, Mental Illness and Addiction Services in Canada. I saw this develop in Ottawa. I spent a lot of time advocating in Ottawa for investments in health research, and this really was a watershed. It really shone the light on the deficiencies of the mental health care system in Canada and the stigma associated with psychiatric diseases. And out of that came the creation of the Canadian Mental Health Commission. And I think that was the first time that the federal government really did stand up and say, oh my God, we've got a problem here, we need to do something about this. So the Mental Health Commission was formed, and that then led to the advocacy with provincial and territorial governments to create more investment and to start thinking about evolving the mental health system, which was pretty much stuck as it had been in the 1800s, I think. This awareness has also been transmitted to employers now. So we now have national employment standards for mental health, for recognizing mental health issues, and how to deal with them further. Has stigma changed? I think it really has changed, because 10 years ago it was incredibly difficult to get philanthropy from our community, but I think across Canada, to invest in mental health research. That has changed enormously over the last 5 years. Our ability to get philanthropic gifts from our community here in London to support mental health has changed enormously, and the willingness of people to donate now to really moving along mental health research has changed exponentially for the better. So Amrish, throughout his career, has really contributed enormously to our sort of paradigm shift in our understanding of mental health. And I think it's no coincidence that through his leadership and the leadership of others in our community, we have some of the most innovative programs in mental health anywhere in the country, particularly I think in youth intervention. If you look at programs like the PEP program and the FEMEP program, they are really leading the way, and have been adopted by other jurisdictions around the world. So this new book, The Mind Matters, I think is a little bit different from what Amrish has done before. This is not a scientific book. This is a collection of short stories. If you just read the stories by themselves, they're fascinating. But after the story is the analysis of where it went wrong, how it could intervention could have taken place, and where there were interventions that had a positive effect, and we can learn from that, Amrish points those out as well. So it's a very readable book. It's certainly not your hard science by any means, and therefore it's a pleasure to read. I think, I'm not sure where you want to go after this, Amrish, because you've done the illustrious academic career. You clearly have enormous skills in communication and knowledge translation. And I'd like to think that this is one step on a forward journey where you're going to now move this sort of communication better. But you can explain that better than anybody else, so I'm going to hand it over to you.
Thank you, David. I think we can have the steep duty of releasing this, open this, and thank you. Actually, I know I have been speaking and talking since about an hour, but I think I would be a little more selfish to take some time that it has given. And on a serious note, we'll talk about this book, because I really want you to read this book. The first question that somehow whenever I was seeing patients and treating them, each and every patient, it was like a film. You be with the patient in the hospital for 1 month and in the outpatient for 2 years, 3 years. It's a very strong association with the patients and families, and it's not touch and go and prescribe, and it's intense. The psychiatric treatment is very intense. You remain involved and you don't remain involved. You are objective, but you have your opinions, you have subjectivity, you have prejudice, you have your own. You want to say something and advise, but then you hold back. No, I put the facts in front of you. Should I go for a job? Well, going to job has this risk and this merit. You decide. I know that you cannot decide, but still my teachers, my things has told me no. Only so much. Not. So this, in a relationship, walking 2 steps forward, 1 step backward, then again 2 steps forward, and again 2, getting frustrated, you're not following my treatment, you're not following my advice, and the relatives don't listen, they don't come when I want them to come, and they inform about the medications only after they run out of it, and they stop it, and by not taking 1 tablet, we have seen the relapse. And all these things, it happens with everybody. It's not just me. And I'm sure my patients and their relatives have their own story to tell me that. But I have one strength. My strength is that I have lived the life of a doctor, a patient, as well as a relative, in many fields, and that's my strength. And I think and I have been with the governments. So the 4 pillars: the disease, the patient, the family, and the system. So I have my footings all across, and it has stirred me reasonably well. And because the problem is complex. Look at the problem. What are we talking about? We're talking about mind. So we say ancient, historical, spiritual, religious, physical, biological, chemical, psychological, occupational, existential, and so there's no limit, no boundary. Anytime you read a poetry, you read a text, you feel each one of them are psychologists. Probably they understand human behavior far better than I was. Here is that I was told when I nobody writes a book for others. It's the fact. Everybody writes a book for himself. After the books are written, they become for others. And then people start thinking, what it can sell. We can have some money. Otherwise, nobody begins with a project that I'll write a bestseller and million. And that is why publishers have lost their money. They have paid millions of dollars and the books have not been completed. Anyway, it's a pleasure that I could do this. It was on my mind for a number of years. And for every activity, right time has to come. It came last year. And thanks to my family and thanks to Rakesh Mandari sitting here. He's a personal friend for the last 50 years, and it was, I would say it was quite a push that I must do it now. And thanks to everybody who remained involved. And I don't think it is, it's nothing big, but it calls for celebration, and I thought I'd better celebrate with people here rather than in my house. And I'm really enjoying. But as I was telling to Robbie that why this book and what is in this book, to be candid, I do not find a book where I can say that, well, here it is written that depression improves. I don't find that book. And I would like to be enlightened that where in the library is that book which I can tell my patient that go and pick up that book and it is written that the problem that your son has, such problems improve. Now, it is another sad story that people don't write stories. Particularly, look at, we have seen the patients, nobody else, thousands and hundreds of thousands. But we don't feel that we should write for people who need to know about it. We are very, very, very happy writing papers, that will say, Ravi, you write a piece and you write a piece, we'll put together something and this project, that grant and that paper, that publication, book check, and everything is fine, it goes on. But really, who needs that knowledge? Who needs to know that my problem can recover? When the fact of the matter is the psychiatric problems improve far better than many other medical counterparts. And the fact that we don't know it, we remain in more distress. And we sure right at the time of diagnosis and much before the diagnosis. So this was one, in one line if I have to describe that, what is this book about? I have shown on the slide that there are examples of success in treatment of mental disorders. In preface I wrote that I'm thankful to those who trusted me and my skills to really provide me an opportunity to treat them. It was a treat to really treat them, no doubt. Not that we did. I failed, I miserably failed in doing the treatment. I've succeeded, I've enjoyed. But all in the process, one thing which happens commonly to doctors, that they never stop taking another patient with the same challenge to treat them without knowing what the challenge would be. Without knowing, it's not a machine. As I was saying that we don't know certain, the treatment is over and we don't know certain objective data which we needed to know. And we finally come to know on the last day before discharge, and that changes the story. So it has been a very simple writing and something that I wanted to communicate. And I hope those who will read it's for them to raise questions and ask. I'm very happy to respond whatever you want to know, but it would not be really correct for me to go into the depth of stories that what I wrote, what I did not write. But a broader framework is that thanks to those who chose me and gave me an opportunity to submit their body and mind to me to really do something which they expected and they believed that I can do. I did, I failed, I won and enjoyed, whatever, it's fine. But that they continue to have faith is a matter of, it's God's grace. And so this is, in a nutshell, probably this is what.
Well, I think you've done a terrific job, Amrish, and to testify everybody's here and a successful launch of the book. The one thing I'd like to ask before we finish is what's left for us to do, Amrish? Where do we go from here, and what can we as a group help? Because there's still lots of resistance out there.
Well, actually, when I was about this workshop, after this, when I'm going home, and you ask me, so what next? I would certainly say, sometimes you have to be really kind of